Thank you, Mr. Speaker, for this opportunity and to contribute to this report of Health Committee of the House. Mr. Speaker, I wish to take this opportunity to thank the committee for having comprehensively outlined the issues affecting our hospitals across the board. Mr. Speaker, right to health is paramount. But unfortunately, in as much as the government at the national level is doing, there is literally very little that is happening at our county levels. Mr. Speaker, patients are really suffering in our hospitals. And if I may start with my own county, yesterday, all the doctors put down their tools. And KPDMU actually advised the county government to have a sitting with them and iron out the issues affecting the doctors in Isiolo County. But surprisingly, they are unable to get the governor of the county of Isiolo to sit down with them to listen to their grievances. And Mr. Speaker, if the doctors themselves are not taken care of, if the doctors are not getting their salaries, if the doctors are not actually covered themselves as far as SHA is concerned, there is no way that they will take care of those patients, Mr. Speaker. And I think if I was actually asked, in as much as health is devolved, Mr. Speaker, I wish health should be returned back to the national government because the situation is very bad. Mr. Speaker, service delivery. In the report, you will see that actually most of the infrastructures are dilapidated. And that is the serious situation across the board. And if you look at the budget actually within the county government, you will see that the chunk of the budget of the county government goes to health. But that budget doesn't actually even reach the hospital, Mr. Speaker. Many of the hospitals, and a very good example is of Isiolo, the hospitals are dependent on FIF. Nobody knows where the budget is going, Mr. Speaker. Because if the hospital collects about 2 million, and the requirement of the hospital is almost 2 billion, how will they cover those costs, Mr. Speaker? There is a very serious situation that is happening in our counties, Mr. Speaker. I saw KPDMU actually telling Isiolo people yesterday, go to the hospital and collect your patients from the hospital because the doctors are not going to be there. That is a very serious situation. And I think maybe Senator for Meru should also look at that clip because Meru was also mentioned. And the patients are told, Isiolo community were told, go to Laikipia or Tharaka Nithi for service delivery. Doctors are not going to be there. It's a very serious and pathetic situation, Mr. Speaker. Mr. Speaker, the issues of promotion, Mr. Speaker, in the counties, as far as the doctors are concerned, nurses, clinical officers, they are all politically driven. If you are not aligned to the current regime, Mr. Speaker, and those are one of the grievances raised by the doctors, you will not be promoted. Mr. Speaker, doctors and nurses, they don't have tools, they don't have gloves, they don't have masks, and I wonder what they are going to do in those hospitals if they are not properly equipped and even protected. You can imagine SHA is there, but the doctors themselves, they are not covered. Nurses are not covered. The county government staff, they are not covered medically. How will they serve those patients, Mr. Speaker? It's a very serious situation, Mr. Speaker. You will see that the revenue is being collected at the county level. And the manner in which the revenue is collected, Mr. Speaker, you pay cash and it is not actually automated. Cash casuals have been actually going without salary for almost 2 years. And they are the people who actually do the dirty job in those hospitals, especially cleaning the blood in those hospitals. Patients who are very sick, they're the ones who take care of them. How will those staff, especially the casuals? And I think as a Senate, we really need to deal with the issues of casuals in the county government. Because you cannot expect a casual who is earning 15,000 or 17,000 to stay without salary for 2 years or a year plus. And you expect that particular staff to perform his or her work. And we are just quiet. Mr. Speaker, I do appreciate what actually the committee has done. And you can imagine, Mr. Speaker, like a staff of Isiolo County, for the last 3 months, they have gone without salary. 3 months, Mr. Speaker. Some of them, they live in rental houses. And the tenants are saying, if you work for the county government of Isiolo, we are not going to give you a house. You better look for a house elsewhere. Share contribution is not actually remitted for the staff, Mr. Speaker. They have taken loans, Mr. Speaker. Those loans are not paid in time. Promotion is not coming. And actually, some of the doctors are forced to even go out and work outside. And the work of the hospital is left to the students who are in KMTC. Today, we have so many cases of actually maternity negligence, where mothers are actually dying at the delivery table. Mr. Speaker, in as much as we say that a lot is being done, our people are really suffering. Dispensaries in those counties, they have no drugs, they have no equipments, and the distances, Mr. Speaker, especially in case of emergency, those patients travel on a rough road, which is over 200 kilometers. And especially the mothers who have complication, they do die before even they reach where they are being taken care of. Mr. Speaker, this is a very good report, and I think this is affecting most of the counties across the board. Senator Wambua talked about CHVs. In Kenya today, how can you pay somebody 2,500 for a month? That is even below the labor law standard. If we really want to keep the CHVs, Mr. Speaker, we need to formalize that particular structure. We need to actually facilitate them, because these are the people who walk around from one place to the other to take care of patients, to report emergencies. Mr. Speaker, CHVs are really suffering. If we don't want to take care of them, Mr. Speaker, they should be actually left alone. Why do you give somebody 2,500? Because today, if I walk to even any of the supermarkets in this country, with 2,500, I can buy nothing, Mr. Speaker. It's really embarrassing to this particular country. Mr. Speaker, I said earlier, and I will say today and tomorrow, that the health care system in Kenya is not doing the best. The standard that is kept in those hospitals, because I remember when CS Health came here, I asked him who is supposed to take care of the standards within the county government. And he said, us, the national government. But those standards are not kept. You can imagine even promotion. Sometimes people are promoted when they don't even have qualification for those particular positions, Mr. Speaker. How will they manage those hospitals? How will they manage revenue? How will they manage patients, Mr. Speaker? So the issue of standard, and I've been along in this Senate, we have actually said several times, the standards of the hospitals in those counties should be with the national government. And I think national government is also running away from that responsibility because they are saying they will not micromanage governors within those counties. Medical equipments that were there, the mess, those equipments were really helping Kenyans, especially the dialysis machines. And if you go and check in some of the hospitals, those dialysis machines, most of them, they are obsolete, Mr. Speaker. Patients are suffering. Cancer patients, they are really struggling. And Mr. Speaker, if I was asked, I will even say SHA should be paid for all the citizens in those counties. The county government should pay actually SHA for citizens. They don't have to suffer. If medical services or medical care is free, why can't we allow county governments to pay SHA for their citizens, where they'll be able to get service delivery? Mr. Speaker, this is a very good report because it's really hurting. National government is doing a lot, but at the county level, I'm sorry to say, things are really wanting, Mr. Speaker. The standard of actually theaters, I remember 3 weeks ago, in my own county, the theater was not functioning because it had a problem. What will people do? Where will they run to? The staff are demoralized. There are no drugs, essential drugs, even paracetamols, leave alone anything. Mr. Speaker, let me stop here, but I will request that as a Senate, we should not actually put these reports in archives. We should follow up to make sure that the recommendation of the committee has been implemented. Mr. Speaker, the oversight institutions that are supposed to look at these issues that are affecting our people in the counties, they should wake up and actually deal with the mess within those health facilities in our country. And I wish to support the report. I thank you, Mr. Speaker.
Senator Mulugo.